On the morning of October 15, 1944, Dr. Hiroshi Tanaka stood in the makeshift surgical ward of a field hospital on the island of Leyte, Philippines, staring at a small glass vial that would shatter everything he believed about the enemy he had been taught to despise. The vial contained a yellowish powder, and the label read in clear English letters, Penicillin, grueling batches of which American factories were producing at the rate of 650 billion units per month. Tanaka held it up to the grey light filtering through the tent canvas, turning it slowly, as if examining a religious artifact from an alien civilization. He had expected to find morphine in the captured American medical kit. He had expected sulfur drugs, perhaps some advanced surgical instruments. What he had not expected was a miracle. The Japanese Medical Corps had been told that American soldiers were soft, pampered, unable to endure the hardships that Japanese warriors accepted as their destiny. They had been assured that Japanese spirit and discipline would overcome any material advantage the Americans possessed. But as Tanaka catalogued the contents of that single medical kit, recovered from an American field medic who had been captured during the initial landings, he felt the first cold tremor of doubt that would eventually become an avalanche of revelation. Before we dive into this story, make sure to subscribe to the channel and tell me in the comments where you're watching from. It really helps support the channel. What Dr. Tanaka discovered that October morning, and what his colleagues across the Pacific Theater would gradually come to understand, was not merely that America possessed superior medicine. It was that the entire foundation of Japanese assumptions about the conflict, about their enemy, and about the nature of modern industrial power was catastrophically, irreversibly wrong. This is the story of how a yellow powder in a glass vial became a window into an industrial capability so vast that it would transform not only the practice of medicine, but the very psychology of those who witnessed it. Dr. Hiroshi Tanaka was 38 years old in October of 1944, a graduate of Tokyo Imperial University's medical school, and a man who had devoted his career to the treatment of infectious disease. Before the conflict began, he had published 17 papers on bacterial infections, had studied briefly in Germany, and had been considered one of the rising stars of Japanese tropical medicine. He had volunteered for military service in 1942, believing that his skills would be invaluable in the Pacific campaigns, where disease claimed more lives than combat. He was right about that, at least. In the first 2 years of his service, Tanaka had watched helplessly as malaria, dysentery, dengue fever, and infected wounds claimed thousands of Japanese soldiers. The medical supplies were always inadequate. The sulfur drugs were rationed so severely that he often had to choose which patients would receive treatment and which would be left to their body's own defenses. He had become grimly expert at battlefield amputations, at the removal of gangrenous limbs with inadequate anesthesia, at the quiet conversations with young men who knew they were going to perish from infections that, in a properly supplied hospital, would have been treatable. Through it all, Tanaka had maintained his faith in the ultimate victory. He had believed what he was told, that Japanese spirit would triumph over American materialism, that the enemy's soldiers were too attached to comfort to fight with true determination, that the tide would turn when America's population grew weary of the sacrifices required for a distant conflict. He had repeated these assurances to dying patients, had written them in letters to his wife Michiko in Osaka, had used them to quiet his own doubts in the sleepless nights when he could still hear the screams of men whose wounds he could not properly treat. The American medical kit changed everything. It had been brought to him by Lieutenant Kenji Yamamoto, a young intelligence officer who had been tasked with cataloging captured enemy equipment. Yamamoto was 24, eager, still convinced of inevitable victory, and he had presented the kit to Tanaka with the casual assumption that it would contain nothing of particular interest. "Field medicine is field medicine," he had said, dropping the olive-drab canvas bag on Tanaka's examination table. "Perhaps you will find something useful for our own supplies." Tanaka opened the bag and began removing items one by one, laying them out on the table with the methodical precision that characterized everything he did. Bandages, sterile and individually wrapped in quantities that seemed almost wasteful. Morphine syrettes, 9 of them, each containing a dose that would have been carefully rationed in a Japanese kit. Sulfanilamide powder in generous packets. surgical instruments of a quality that made Tanaka's own tools look like relics from the previous century. And then, in a specially padded compartment, the vials of penicillin. Tanaka recognized the word immediately. He had read about penicillin in German medical journals before the conflict, had followed with professional interest the British discovery of the mold's antibacterial properties, had even attempted to culture his own samples in his Tokyo laboratory in 1940. But he had believed, as he had been told to believe, that penicillin was a laboratory curiosity, impossible to produce in meaningful quantities, years away from practical medical application. He held up one of the vials and read the label more carefully. The manufacturing date was August 1944, barely 2 months earlier. The production facility was listed as a plant in Indiana. The dosage instructions were printed clearly, indicating that this was a standardized medication, produced in sufficient quantities that individual soldiers could carry it into combat. "How much of this do they have?" Tanaka asked, his voice barely above a whisper. Yamamoto shrugged. "Every American medic carries this kit," he said. "We have captured 7 kits so far. They are all the same." Tanaka did a quick calculation in his head. If every American medic carried this much penicillin, and if the American forces on Leyte numbered in the tens of thousands, as intelligence suggested, then the Americans had brought more penicillin to this single island than existed in all of Japan. The implications were staggering. He spent the next 3 hours examining every item in the kit, making detailed notes, comparing the American supplies to his own meager inventory. By the time he finished, his hands were trembling, and not from fatigue. He had just glimpsed the true face of the enemy, and it was not the face of softness or decadence that propaganda had promised. It was the face of an industrial civilization operating at a level of production that Japan could not match, could not approach, could not even properly comprehend. That evening, Tanaka requested a meeting with Colonel Masao Ishida, the commanding officer of the field hospital. Ishida was a career military man, a surgeon who had served in China and who maintained rigid adherence to the official doctrine of Japanese superiority. He listened to Tanaka's report with growing irritation, his face darkening as the younger doctor described the contents of the American medical kit. "You are reading too much into a single piece of equipment," Ishida said when Tanaka finished. "The Americans are known for their wasteful abundance. This proves nothing about their overall capabilities." "With respect, Colonel," Tanaka replied carefully, "this proves everything." He held up one of the penicillin vials. "Do you understand what this represents? 2 years ago, penicillin existed only in laboratories. Now they are giving it to individual soldiers. The production capacity required to achieve this, the industrial infrastructure, the scientific coordination, it is beyond anything we have been told about the enemy." Ishida stood abruptly, his chair scraping against the wooden floor. "You will not spread defeatism among the medical staff," he said coldly. "The American materials are impressive, yes. But materials do not win conflicts. Spirit wins conflicts. Discipline wins conflicts. The Americans have neither." Tanaka bowed his head in formal acknowledgement, but he did not change his assessment. Over the following days, he quietly shared his findings with the other doctors in the field hospital, men he trusted to understand the medical implications without succumbing to despair. Their reactions varied, but none of them could dismiss the evidence that sat before them in carefully labeled vials. Dr. Yoshio Nakamura, the hospital's chief surgeon, was 53 years old and had practiced medicine for 3 decades. He examined the penicillin with the same careful attention that Tanaka had given it, reading the labels, inspecting the powder, calculating the dosages. When he finished, he sat in silence for a long moment, then spoke in a voice that Tanaka would remember for the rest of his life. "We have been operating in darkness," Nakamura said quietly. "We thought we understood the world, but we understood nothing. This single vial represents more industrial capacity than our entire pharmaceutical industry, and they are producing it by the ton." "How do you know that?" Tanaka asked. "Because of the date," Nakamura replied. He pointed to the manufacturing stamp on the vial. "August of this year. Think about what that means. In August, this penicillin was powder in a factory in America. By October, it is here on a jungle island on the other side of the Pacific, in the hands of an individual soldier. The logistics required to achieve that, the shipping, the refrigeration, the distribution networks, it requires a civilization operating at a level we have never approached. The other doctors gathered around, listening to Nakamura's analysis. There was Dr. Takeshi Mori, a young internist from Kyoto who had been drafted only 6 months earlier and who still wore his idealism like armor. There was Dr. Saburo Endo, a grizzled field surgeon who had served since the China campaign and who had seen enough suffering to strip away most illusions. There was Dr. Fumiko Sato, one of only 3 female physicians in the Japanese military medical corps, who had fought prejudice her entire career and who approached every problem with rigorous analytical precision. They passed the vials among themselves, reading the labels, handling the glass with the care of archaeologists examining artifacts from a lost civilization. And, in a sense, that is exactly what they were doing. Tanaka realized they were examining artifacts from a civilization that had seemed, from the outside, to be their enemy's weakness, the civilization of mass production, of standardization, of industrial efficiency applied to every aspect of human existence, including the practice of medicine. Dr. Sato was the first to articulate what they were all thinking. If they can produce this, she said, holding up the penicillin, what else can they produce? If they can supply their individual soldiers with medications we cannot supply to our hospitals, what does that tell us about their capacity for everything else? Their aircraft, their ships, their weapons, their food? No one answered because no one needed to. The question contained its own response. Over the following weeks, Tanaka began a systematic study of captured American medical equipment. More kits were recovered as the fighting on Leyte continued, and each one confirmed and expanded upon his initial findings. He catalogued everything with scientific precision: the quantities, the quality, the manufacturing dates, the production facilities. He created charts showing the disparity between American and Japanese medical supplies, calculating ratios that grew more alarming with each new data point. The Americans, he discovered, provided their soldiers with an average of 8 times more medical supplies per capita than the Japanese military could provide. Their bandages were of higher quality cotton, more absorbent, more sterile. Their morphine was more pure, their sulfur drugs more concentrated, their surgical instruments more precisely manufactured. And the penicillin, that yellow powder that had started his investigation, was merely the most visible symbol of an industrial advantage that extended to every aspect of military medicine. But it was not only the quantity that astonished him, it was the standardization. Every American medical kit he examined was identical to every other. The vials were the same size, the labels were the same format, the dosage instructions were the same wording. This meant that any American medic could use any American medical kit without confusion, that supplies could be transferred between units without compatibility issues, that the entire medical infrastructure operated as a single coordinated system across thousands of kilometers and millions of personnel. Japanese medical supplies, by contrast, were a patchwork of different manufacturers, different standards, different formats. Tanaka had personally experienced the frustration of receiving shipments where the syringes did not fit the needles, where the bandages were sized for different wounds than the ones he was treating, where the medications came with instructions that contradicted the training he had received. The Japanese military medical corps was not a system. It was a collection of individual efforts, heroic in their dedication, but fundamentally inefficient in their organization. The standardization tells us something important, Tanaka explained to his colleagues during one of their evening discussions. It tells us that the Americans have solved the problem of industrial coordination. They have found a way to make thousands of factories, millions of workers, produce identical products to identical specifications. This is not merely a matter of resources. It is a matter of organization, of systematic thinking, of a fundamentally different approach to production. Dr. Endo, the old field surgeon, nodded grimly. "I saw this in China," he said. "Not with medicine, but with everything else. We would capture American equipment, trucks, radios, generators, and they were all the same, every part interchangeable. We would capture our own equipment, and half of it could not be repaired because the replacement parts did not fit. I thought it was just bad luck. Now I understand it was something more. It is the difference between craft and industry, Dr. Sato added. We still think like craftsmen, making each item individually with individual variations. They think like engineers, making each item as a copy of a perfect template. In medicine, this means that every American soldier receives the same standard of care. In our military, the standard of care depends on which unit you are assigned to, which supplies happen to arrive, which doctor happens to treat you. The conversations continued night after night, always in low voices, always with one person watching the entrance to ensure they were not overheard. Colonel Ishida had made clear that defeatism would not be tolerated, and what they were discussing could certainly be characterized as defeatist. But Tanaka believed that they were not discussing defeat. They were discussing truth. And truth, however painful, was preferable to the comfortable illusions that had brought them to this point. In early November, the hospital received a new patient who would provide Tanaka with another window into American medical capabilities. His name was Private First Class Thomas Anderson, a 22-year-old medic from Minnesota who had been captured during a patrol action near Tacloban. Anderson had been wounded in the leg during his capture, a deep laceration that had become infected during the 3 days before he was brought to the Japanese field hospital. Tanaka examined the wound and recognized immediately that it would require amputation under normal circumstances. The infection had spread too far, the tissue was too damaged, the risk of gangrene too high, but Anderson, delirious with fever, kept repeating the same words over and over. "Penicillin, give me penicillin, it is in my kit." The kit had been confiscated, of course, but Tanaka had retained the penicillin for study. Now he faced a decision. He could amputate Anderson's leg, the standard treatment for such severe infections. Or he could use the American's own medication to attempt something that Japanese doctors had only read about in journals: the treatment of systemic infection with antibiotic therapy. He chose the latter. For 3 days, Tanaka administered penicillin to Anderson, according to the dosage instructions on the vial. He monitored the wound constantly, cleaning it, changing the bandages, watching for signs of improvement or deterioration. He kept detailed notes on every aspect of the treatment, determined to document the medication's effectiveness regardless of the outcome. On the 4th day, Anderson's fever broke. On the 6th day, the infection began to recede. On the 10th day, the wound was healing cleanly, with healthy tissue forming over what had been a suppurating mess of damaged flesh. Tanaka stood over his patient, watching the American sleep peacefully for the first time since his capture, and understood that he had just witnessed something that would change medicine forever. He gathered his colleagues that evening and showed them his notes. "The results were beyond anything we hoped for," he said. "The infection is eliminated. The tissue is regenerating. He will keep his leg." Dr. Nakamura studied the notes carefully, his face unreadable. "This is not just a new medication," he said finally. "This is a new era of medicine. Infections that have ended men since the beginning of time can now be treated. Wounds that would have been fatal are now survivable. Do you understand what this means for the future?" Tanaka nodded. "I understand, and I understand something else. The Americans have this medication in quantity. Their wounded receive this treatment as a matter of course. Our wounded receive nothing." He paused, struggling to find the right words. "We are not losing this conflict because of spirit or discipline. We are losing because we are trying to match the 20th century with the 19th. The words hung in the air, unspeakable and undeniable. Anderson recovered fully over the following weeks, and during that time, Tanaka spoke with him often. The American was initially suspicious, expecting torture or mistreatment, but Tanaka's consistent professionalism and the quality of his care gradually broke down those barriers. They spoke about medicine, about their training, about the differences between their respective healthcare systems. Anderson was surprised to learn that Japanese doctors were well-educated and sophisticated. Tanaka was surprised to learn that American medics received training that would qualify them as physicians in many countries. One conversation in particular stayed with Tanaka for years afterward. He had asked Anderson about the production of penicillin, about how the Americans had achieved such remarkable quantities of a medication, that had been a laboratory curiosity just 3 years earlier. Anderson had shrugged, as if the answer were obvious. We decided it was important, so we figured out how to make it happen. That is how we do things. If something matters, we find a way to do it on a large scale. But the technical challenges, Tanaka pressed. The fermentation process, the purification, the standardization across multiple facilities. How did you solve these problems so quickly? Anderson thought about it for a moment. I do not know all the details, he admitted, but I know we had a lot of smart people working on it. Scientists, engineers, factory managers, all working together. And we had the resources to try things that did not work until we found things that did. I guess when you have enough people and enough materials and enough determination, you can solve most problems. Tanaka nodded slowly, recognizing in Anderson's casual explanation the essence of what made American industrial production so formidable. It was not any single advantage. It was the combination of resources, expertise, organization, and will. It was the ability to identify a goal and mobilize an entire society toward achieving it. Japan had will in abundance, but it lacked the other elements, and will alone, Tanaka was coming to understand, was not sufficient. In December, Tanaka was transferred from Leyte to a larger facility in Manila, where he continued his work with an expanded scope. He was given access to more captured equipment, more American prisoners, more opportunities to study the enemy's medical capabilities. What he learned only deepened his initial conclusions. The Americans had not just solved the penicillin problem, they had transformed their entire medical system to take advantage of it. They had developed new surgical techniques that assumed the availability of antibiotics to prevent post-operative infection. They had created new evacuation protocols that moved wounded soldiers more quickly to facilities where they could receive advanced care. They had trained thousands of medics to administer treatments that, 2 years earlier, had been available only in research hospitals. And they had done all of this while simultaneously fighting a conflict on 2 fronts, supplying armies across 2 oceans, and maintaining a civilian economy that continued to produce consumer goods for the domestic population. The productive capacity was almost incomprehensible. Tanaka documented everything he learned, filling notebooks with observations, calculations, and analysis. He did not know what would happen to these notes, whether they would ever be seen by anyone who could act on them. But he believed that truth had value in itself, that understanding reality was the first step toward any meaningful response to it. He was also treating patients, both Japanese and American. The contrast in their conditions was stark and painful. Japanese soldiers arrived with infections that should have been easily treatable, with wounds that had been inadequately cleaned, with malnutrition and tropical diseases that reflected the breakdown of supply lines. American prisoners arrived in relatively good condition, often with evidence of excellent initial treatment, and they recovered quickly because their bodies had not been weakened by months of deprivation. One Japanese sergeant named Noboru Kitamura arrived in January 1945 with a shrapnel wound to the abdomen that had become severely infected. Tanaka examined him and knew immediately that the prognosis was poor. The infection had spread beyond the wound site. The patient was already septic, and without antibiotics there was little that could be done. Tanaka thought of the penicillin he still had, the remaining vials from the captured American kits. He had been saving them for study, for documentation, for some future use that might contribute to Japanese medical knowledge. But here was a Japanese soldier who would perish without them. He made his decision. Over the next 5 days, Tanaka treated Kitamura with penicillin, using the same protocols he had developed with Anderson. He watched the same miraculous progression, the fever breaking, the infection receding, the tissue healing. And he watched Kitamura's face as the sergeant realized that he was going to live, that the death sentence he had accepted was being commuted by a yellow powder from an enemy factory. "What is this medicine?" Kitamura asked on the 3rd day, his voice weak but clear. "Where did it come from?" Tanaka hesitated, then told the truth. "It is American. We captured it. It is called penicillin." Kitamura was silent for a long moment. Then he said something that Tanaka would never forget. "Why do they have this and we do not?" Tanaka had no answer that would satisfy either of them. By February, the situation in the Philippines had deteriorated beyond recovery. The American forces had established control over most of Luzon, and the Japanese military was fragmenting into isolated pockets of resistance. Tanaka's hospital was evacuated twice, each time moving to a more remote location, each time losing equipment and supplies in the chaos of retreat. During this period, Tanaka had a conversation with a Japanese colonel named Tetsuro Hayashi, an intelligence officer who had been collecting information on American capabilities throughout the campaign. Hayashi was a realist, a man who had long since abandoned the comfortable illusions of inevitable victory, and he was willing to speak frankly in a way that most officers were not. "We have lost this conflict," Hayashi said bluntly during a quiet conversation in Tanaka's tent. "We lost it before we began. We lost it when we decided to challenge an industrial power that outproduces us in every category by factors of 5 or 10 or 20. We lost it when we believed that spirit could compensate for steel." Tanaka nodded, unsurprised. "The penicillin told me the same thing 6 months ago." Hayashi laughed bitterly. "The penicillin is just one example. Do you know how many aircraft the Americans produced last year? Nearly 100,000. Do you know how many we produced? Perhaps 30,000, and most of those were inferior models using inferior materials. Do you know how many ships they launched? Enough to replace their entire navy twice over." Tanaka absorbed this information, adding it to his growing understanding of the disparity they faced. "And yet we continue to fight," he said. "Because we do not know how to stop," Hayashi replied. "Because stopping would require admitting that everything we believed was wrong. Because we have trained our people to see surrender as the ultimate dishonor. So we continue, and more young men are lost. And nothing changes except the scale of the tragedy." They sat in silence for a while, two men who understood the truth and were powerless to act on it. Finally, Tanaka asked the question that had been forming in his mind for months. "What happens after this conflict ends?" he asked. "What happens to Japan?" Hayashi considered the question carefully. "That depends on the Americans," he said finally. "If they are vengeful, they will destroy us. If they are pragmatic, they will rebuild us." His face was thoughtful. "From what I have observed of them, I believe they will be pragmatic. They do not seem to hate us the way we were told they would. They seem to see this as a problem to be solved, not an enemy to be annihilated." Tanaka thought about the American medic Anderson, about their conversations, about the matter-of-fact way Anderson had described the penicillin production effort. A problem to be solved. Yes, that seemed right. The Americans approached everything as a problem to be solved, including the aftermath of the conflict itself. In March 1945, Tanaka was captured during the final collapse of Japanese resistance in Manila. He had stayed with his patients until the end, refusing evacuation, continuing to provide care even as American forces closed in on the hospital. When the American soldiers entered his ward, they found a Japanese doctor performing surgery on a wounded Japanese sergeant, using the last of his supplies, working by the light of a kerosene lamp because the electricity had long since failed. The American officer in charge was a captain named Robert Mitchell, a medical corps administrator from Pennsylvania who had been tasked with securing Japanese medical facilities. Mitchell observed Tanaka for several minutes, watching him complete the surgery with skill and precision despite the impossible conditions. Then he approached and spoke in passable Japanese. "You are a physician," Mitchell said. It was not a question. "I am," Tanaka replied, not looking up from his work. "I am treating my patient." Mitchell nodded. "You will be treated as a prisoner according to the appropriate conventions," he said. "Your patients will receive medical care. Your staff will not be harmed." Tanaka finished the surgery, closed the incision, and finally looked up at the American officer. "Your conventions," he said carefully. "Will we receive the same care as your own wounded?" Mitchell seemed surprised by the question. "Of course," he said. "Why would it be otherwise?" Tanaka did not answer, but he felt something shift inside him, some final confirmation of everything he had learned over the past 6 months. The Americans did not think of medical care as a privilege to be withheld from enemies. They thought of it as a standard to be applied universally. The same civilization that had produced penicillin by the ton had also produced an ethical framework that extended its benefits to those it had conquered. Over the following months, Tanaka experienced this framework directly as a prisoner. He was moved to a succession of facilities, each one characterized by adequate food, reasonable conditions, and access to medical care when needed. He was interrogated about Japanese medical practices and military dispositions, but the interrogations were professional rather than brutal. He was eventually transferred to a camp in the Philippines, where Japanese medical personnel were separated from other prisoners and given opportunities to assist with the treatment of their compatriots. It was in this camp that Tanaka had his final transformative encounter with American medical capabilities. He was summoned one day to the camp hospital where the American chief medical officer, a lieutenant colonel named William Foster, was waiting for him. Foster was a 45-year-old surgeon from Chicago who had spent his career in academic medicine before the conflict and who approached even enemy prisoners with scientific curiosity rather than hostility. "Dr. Tanaka," Foster said, "I have been reviewing your records. Your colleagues speak highly of your work with infectious disease. I have a proposal for you." Tanaka waited, uncertain what to expect. "We are treating a large number of Japanese prisoners with various infections," Foster continued. "Dysentery, malaria, wound sepsis, tropical ulcers. We have the medications to treat them, but we lack sufficient medical staff to administer the treatments properly." He paused, watching Tanaka's face. "I would like you to work with us, to help us treat your countrymen." Tanaka was silent for a long moment, processing the offer. Work with the enemy, treating Japanese patients using American medications. It was an arrangement that would have been unthinkable 6 months earlier, that violated every principle of military loyalty he had been taught. And yet, looking at it from another angle, it was simply the practice of medicine, the application of knowledge to the relief of suffering, regardless of uniforms or flags. "You would give me access to your medications?" Tanaka asked carefully. "Including penicillin?" Foster nodded. "Full access, whatever you need. And I would be permitted to document the treatments, to keep records that might contribute to medical knowledge." Foster smiled slightly. "I would insist on it. This is an opportunity to study tropical diseases on a scale we have never had before. Japanese patients, American medications, controlled conditions. The research potential is significant." Tanaka made his decision. He accepted. For the next 4 months, until the conflict officially ended, Tanaka worked in the American camp hospital, treating Japanese prisoners with American medications. He administered penicillin to hundreds of patients, documenting the results with the same meticulous care he had applied to everything else. He learned to use American surgical instruments, American diagnostic equipment, American treatment protocols, and he talked with American doctors, absorbing their approaches to medical practice, their assumptions about research, their expectations about the future. The conversations with Foster were particularly illuminating. The American surgeon was planning to return to academic medicine after the conflict, to resume his research into surgical techniques, to train a new generation of physicians. He spoke about these plans with casual confidence, as if the future were simply waiting to be claimed. "What will you do?" he asked Tanaka one evening. "After this is over, after you return to Japan?" Tanaka considered the question. The Japan he returned to would be a defeated nation. Its cities destroyed, its economy shattered, its confidence broken. What could he possibly contribute to such a place? "I will practice medicine," he said finally. "I will teach what I have learned. About penicillin, about infectious disease, about the approaches to research and production that make such things possible." Foster nodded approvingly. "Good. Japan will need physicians. It will need scientists, teachers, people who understand how the modern world works." He paused, then added something that surprised Tanaka. "You know, I think we will be allies someday, Japan and America. I think this conflict will be remembered as a terrible mistake, and we will both want to make sure it never happens again." Tanaka was skeptical. "We destroyed much," he said. "There is much anger on both sides." "There is," Foster agreed. "But anger fades. Interests endure, and our interests will align once the conflict is over. You will see." The conflict ended in August 1945, and Tanaka was repatriated to Japan in October. He returned to a country that was almost unrecognizable, cities reduced to rubble, populations displaced, institutions collapsed. But he also returned with something valuable. He returned with knowledge. Over the following years, Tanaka became one of the leading figures in the reconstruction of Japanese medicine. He established a research program in antibiotic therapy at Osaka University, training hundreds of young physicians in the techniques he had learned. He worked with American occupation authorities to import penicillin production technology, helping to establish Japanese pharmaceutical factories that would eventually supply the entire Asian region. He published papers, gave lectures, advised government ministries on health policy. And he never forgot what he had learned on Leyte, in that tent on that October morning, holding a small glass vial up to the grey light. He never forgot that the vial contained not just a medication, but a lesson, that industrial civilization, properly organized, could achieve things that seemed impossible, that the mobilization of resources, expertise, and will could solve problems that had plagued humanity for millennia, that the future belonged to those who understood this truth and acted on it. Dr. Hiroshi Tanaka passed away in 1989 at the age of 83. By then, Japan had become the second largest economy in the world, a technological powerhouse that produced automobiles, electronics, and yes, pharmaceuticals that were exported around the globe. The transformation that Tanaka had witnessed in its earliest stages, the transformation from a nation that could not produce penicillin to a nation that could produce anything, had been completed within a single generation. At his memorial service, one of his former students read a passage from Tanaka's journal, written in October 1944, just days after his first encounter with the American medical kit. The words captured the moment when everything changed, when a Japanese doctor held a vial of yellow powder and glimpsed the future that was coming, whether Japan was ready for it or not. "Today, I understood that we have been living in an illusion," Tanaka had written. "We believed that our spirit made us superior, that our determination could overcome any obstacle, but determination without capability is merely suffering. The Americans have both. They have the will to achieve their goals and the means to make that will manifest in the world. We must learn from them. We must understand how they think, how they organize, how they transform ideas into reality on a massive scale. If we do not learn these lessons, we will remain forever in the position we occupy today, brave, determined, and utterly defeated." The passage was followed by a long silence in the memorial hall. Then Dr. Sato, now 82 years old and still practicing medicine, rose to speak. "He was right," she said simply. "We learned. And look at what we became. And that concludes our story. If you made it this far, please share your thoughts in the comments. What part of this historical account surprised you most? Don't forget to subscribe for more untold stories from World War II and check out the video on screen for another incredible tale from history. Until next time.